I want to take a moment now to look at how the vaccine rollout's going in both of our states. Now in Kansas, health officials reported Wednesday that 35% of the state's population has received at least one dose of a coronavirus vaccine. In Missouri, that number is a little lower at 32.2%. And today, more Missourians will get their first dose of the Pfizer vaccine thanks to Operation Safe. Another clinic's being held in North Kansas City at the Cerner headquarters. Well, to take part, you need to register online through Operation Safe's website. The clinic will continue tomorrow. Operation Safe, by the way, has administered close to 43,000 first dose vaccinations and more than 26,000 second doses. And at Lee Summit, healthcare workers will give out 2,200 doses of the Pfizer vaccine as part of a two-day mass vaccination event at the Legacy Park Soccer Complex. On Wednesday, they gave hundreds of people their first shots. Today's event runs from noon to 8. To take part, make sure you sign up on the Missouri's online vaccine navigator, and the second dose events take place May 5th and 6th. And a CDC panel looking into the Johnson & Johnson vaccine says it needs more evidence and data before deciding if the rollout can continue in the U.S. The FDA and CDC called for a pause in the rollout after 6 women developed blood clots out of more than 7 million vaccinations across the country. Well, health experts say that the women were ages 18 to 48. Top infectious disease expert Dr. Anthony Fauci says that he doubts this pause will last weeks or months. And the change left several local clinics scrambling to get other brands of vaccines, affecting many more people who were signed up to get the shot. Well, Ron Dennis of Kansas City says that he was supposed to get the J&J vaccine Wednesday. Now he won't get a shot until next week. While having to wait is not ideal for Dennis, who is a diabetic senior citizen who has also had cancer, but he's staying positive and trying to look on the bright side.
It takes a weight off your mind. You are safer. I've got nephews. I want to be able to give them really a hug. We can get together.
Well, healthcare workers, meanwhile, in Kansas and Missouri are using the Pfizer and Moderna vaccines for upcoming appointments. Both states have stopped using the J&J vaccine for now. And meanwhile, just hours after Tuesday's recommendation came out, the group that monitors the health of pregnant women recommended that pregnant and postpartum women get either the Pfizer or Moderna vaccines. Now, the American College of Obstetricians and Gynecologists says that the potential for these extremely rare blood clots in young women create the biggest concern.
Pregnancy itself is a risk factor for blood clots. So when you think about that, the serious side effect we're talking about is blood clots, anything you can do to reduce that risk makes sense.
Also, doctors say that pregnant women who have already gotten the Johnson & Johnson vaccine should listen to their bodies. Make sure you call your doctor if you experience any symptoms, including severe headache, abdominal pain, leg pain, or shortness of breath. And again, there are only 6 reports of this happening. Well, 741 and Pfizer Moderna will send 7% more doses to states next week to help make up for the hold on the J&J vaccine. Pfizer will send 5 million doses. Moderna is sending 3.7 million. And preliminary results from phase 3 trials show that Moderna's vaccine is more than 90% effective for at least 6 months after vaccination. The company says the vaccine is also more than 95% effective against severe disease.